Welcome. I'm Dr. Douglas Wingate, Integrative Neurorehabilitation Specialist. I want to take a different approach than you might have encountered before. Rather than talking about depression and anxiety just in terms of symptoms, I want to show you what these conditions actually look like in the brain, the measurable electrical patterns that EEG research has identified, and explain precisely how Neurogen brain balancing targets those patterns directly. Rather than working to manage symptoms, the goal here is to target the mechanisms. Depression affects 280 million people globally and is considered the leading cause of disability throughout the world. Anxiety affects over 300 million people, the single most prevalent mental health condition on the planet. In the United States, 1 in 5 adults experience mental dysregulation in any given year, with depression and anxiety accounting for the vast majority of that. Fewer than half of those receive treatment that adequately manages their situation, held back by stigma or cost, access barriers, and the genuine limitations of existing treatments. And that last number is really important. It's not that people haven't tried. It's that people are still struggling despite trying. So here's where we get into the less talked about parts of depression and anxiety. Both have well-established replicated EEG signatures, measurable brainwave patterns that reliably differentiate these conditions from a regulated brain. For depression, there are 4 consistent findings. First, a right dominant alpha asymmetry. So the left prefrontal cortex of the brain is underactivated, meaning the approach motivation circuit, the part of the brain that drives engagement with life, is actively being suppressed. Second, excess frontal theta activity. This is directly linked to the rumination loops, difficulty feeling joy, and the inability to disengage from negative thought patterns that define depression. Second, excessive frontal theta activity, directly linked to the rumination loops, difficulty with feeling joy, and the inability to disengage from negative thought patterns that define depression. Third, reduced coherence between the prefrontal cortex and the limbic system. The emotional regulation circuitry is literally disconnected. The prefrontal cortex cannot effectively control emotional responses when these circuits aren't communicating properly. And fourth, elevated beta 2 activity in the frontal areas, reflecting hyperactivation in rumination circuits and the negative cognitive bias pattern that is a neurological hallmark of major depressive disorder. For anxiety, we see an essentially complementary pattern of dysregulation. The nervous system is locked in threat detection mode. And this is reflected by elevated high beta power that reflects cortical hyperarousal. So it generates the excessive worry and the physical tension that characterizes anxiety disorders. The brain's calming regulatory patterns are also impaired. Reduced alpha power shows a loss of cortical inhibition, as if the inhibitory brake has failed. We often talk about working for greater brain coherence, but in anxious states, too much overall coherence means that the brain has become over-synchronized and it loses selective filtering. It becomes hypersensitive to all incoming information. And elevated frontal theta also reflects the anticipatory worry circuit and overactive default mode rumination that keeps anxious people unable to be present. These patterns are measurable, and what is measurable can be targeted. And I want to pause on that for a moment because it carries a message that I believe every person dealing with depression or anxiety deserves to hear. The brainwave disruptions of depression and anxiety are not character flaws. They're not failures of willpower or weakness of personality. They're measurable neurological states, and measurable states can be changed. For those depressed, dysregulated brainwaves can produce persistent low mood, hopelessness, and anhedonia, the inability to initiate or sustain motivation, rumination loops that feel impossible to break, and emotional numbness and social withdrawal that can look from the outside like indifference, but are in fact neurological. For those frequently anxious, chronic worry that genuinely feels impossible to stop because it's being generated by hyperactivated neural circuits, physical tension, hypervigilance, and a racing heart that are at the physiological output of cortical hyperarousal, avoidance of situations because of the anticipated threat, and sleep disruption and exhaustion from a nervous system that can't downregulate. Understanding this changes how we think about how to help alleviate these symptoms. Neurogen brain balancing is described in the peer-reviewed literature as a novel, passive, non-invasive neurobiomodulation modality for brain health. 4 features define how it works here. First, it's fully passive. No active tasks, no screens, no cognitive effort. Patients rest while the brain receives and responds to the signal. This removes the performance barrier that active therapies impose on already exhausted patients. And this is a critical point that I'll return to in just a minute. Second, real-time EEG guidance drives every session. Live brainwave data is read and the protocol is generated fresh, identifying and targeting the specific dysregulated patterns present in that person's brain in that moment. Third, lip test microcurrent signaling. Low-intensity pulse transcranial electrical stimulation provides a gentle, generally imperceptible reference signal that supports the brain's own regulatory processes towards a more balanced state. And fourth, neuroplasticity and rebalancing. By specifically targeting frontal alpha asymmetry, prefrontal limbic coherence deficits, and maladaptive beta and theta patterns, Neurogen supports the brain's path toward an oscillatory balance that's associated with mood stability and emotional regulation. Here's how Neurogen addresses the dysregulations I mentioned. Right dominant alpha asymmetry in depression is addressed by EEG-guided protocols that support rebalancing of the left-right frontal activation, working to restore the approach motivation circuitry that depression suppresses. Excess frontal theta, the neurological substrate of rumination, is targeted directly, working to reduce the slow wave overdrive in frontal areas that sustain negative thought loops. Lowered coherence between the prefrontal and the limbic areas responds to the system's support for restoring functional connectivity between them. This rebuilds the emotional regulation pathway from the ground up. On the anxiety side, elevated high beta hyperarousal is addressed by lowering the body's alarm volume through neuromodulation's documented ability to reduce pathological beta overactivation. On the anxiety side, elevated high beta hyperarousal is addressed by lowering the body's alarm volume through neuromodulation's documented ability to reduce pathological beta overactivation. Reduced alpha, the lost cortical inhibition, is supported by rebuilding the brain's calming regulatory brake through passive signaling that helps restore inhibitory alpha rhythms. And dysregulation of the autonomic nervous system that underlies both conditions through sympathetic overdrive is addressed through modulating the vagus nerve that promotes parasympathetic dominance. Every measurable EEG signal has a corresponding neurogen effect. The primary clinical evidence comes from the 80 veteran observational study by Drs. Cassian and Turetsky. 80% of participants completing 4 weekly sessions reported meaningful improvement, and notably, the most commonly improved symptoms were anxiety, depression, sleep disturbances, brain fog, and cognitive function. The broader evidence base supports this specifically. Alpha asymmetry, excess theta, and reduced prefrontal limbic coherence are established replicated EEG biomarkers for major depressive disorder that have been confirmed across multiple published studies. Neuromodulation-based interventions targeting these patterns have shown measurable, significant reductions in depression severity. For anxiety, elevated high beta power and reduced alpha are among the most consistent EEG signatures across anxiety disorders. Lowering cortical hyperarousal through non-invasive neuromodulation has shown reduced symptoms across multiple independent research studies. Here's what I believe to be the single most important clinical rationale for Neurogen in depression and anxiety specifically. Depression and anxiety are precisely the conditions that impair the engagement that conventional therapies require. This is the central treatment paradox. Cognitive behavioral therapy asks a patient with depression to challenge negative thoughts using the cognitive capacity of their prefrontal lobe, the same prefrontal capacity that depression has suppressed. Talk therapy asks someone with severe avoidance and emotional numbing to open up and process. Active forms of neurofeedback asks a fatigued, brain-fogged person to focus on a screen for 30 or 40 sessions. These are all valuable approaches, but they all require someone to engage with a brain that depression and anxiety have specifically impaired. Neurogen removes that paradox entirely. There's no activation threshold to overcome. Depression reduces motivation and initiation, and anxiety creates avoidance. Neurogen requires nothing from the person except to show up. It's accessible even in acute and treatment-resistant states. It's also designed to be adjunctive. It integrates seamlessly alongside medications, SSRIs, SNRIs, anxiolytics, psychotherapy, and somatic approaches. And for those working to reduce medication burden under provider supervision, it can support that process by addressing the underlying oscillatory dysregulation that medications manage only at the neurochemical level. And that's the final point. Medications manage neurochemistry downstream. Neurogen targets the upstream dysregulation that drives the neurochemical imbalance, a fundamentally different point of intervention and a complementary one. For providers making referral decisions, here's a practical guide. Strong candidates include those with major depressive disorder, generalized anxiety disorder, and the very common mixed anxiety-depression presentation. Treatment-resistant and medication partial responders are particularly well suited, as are those who are seeking to reduce their medication burden. For those who cognitive behavioral therapy engagement is currently too difficult, those in the acute or subacute phase are excellent candidates for a passive intervention that doesn't require that engagement. Comorbid insomnia, PTSD, chronic pain, and brain fog all share overlapping neurological mechanisms and frequently improve in parallel. The contraindications are narrow. Active seizure disorder requires consultation. Implanted electrical devices need individual review. Severe acute psychiatric crisis or active psychosis should be stabilized before initiating, and Neurogen is a complement to psychiatric evaluation and standard of care. It's not a replacement. Depression and anxiety are not fixed states. The brain can rebalance. The measurable EEG signatures that characterize these conditions, alpha asymmetry, excess theta, lost coherence, cortical hyperarousal, are not permanent features of a broken brain. They are dynamic patterns that can shift. Neurogen brain balancing targets those patterns directly, supporting the brain's own path toward oscillatory balance, mood stability, and genuine calm. For more information about our integrative neurorehabilitation practice and to schedule a consultation or a session, visit acuneuromodulation.com. For veterans specifically, U.S. military veterans can access 4 free Neurogen sessions through bb4vets.org.